Hello, my name is Mohamed Salama. Currently, I'm Associate Professor at the Institute of Global Health and Human Ecology in the American University in Cairo. Also, I'm a Senior Fellow for Equity in Brain Health, one of the cohort of 2018 for the Global Brain Health Institute, Trinity College Dublin. And I'd like to share with you some of my experience. Maybe it's not that much, but at least hopefully it could help to shed light on how to mobilize community, how to start an initiative, how to build on the current situation to move forward. So in principle, I was a neurogeneticist. My main interests were looking at genetics of certain neurodegenerative disease. Following my fellowship year in Global Brain Health Institute, I started more to appreciate the holistic approach to understand the different features affecting aging-related challenges, aging-related morbidities, healthy aging, and more. And I was thinking of why not we start understanding or studying the current situation in our countries, in our region. I'm originally from Egypt, so it would be appealing to start understanding and evaluating the aging situations, the situation of elderly population in our countries. So returning back to Egypt, I tried to understand how far did we study our aging determinants, and I found that, well, it is not well studied, it's understudied area of research. Maybe also that holistic approach. Yeah, you could find some individual research tackling genetics of certain diseases which are associated with aging, but you will never find something that is talking about aging as one package and also the baseline condition of aging population. So my dream was to start launching a longitudinal aging study in Egypt. And I found out that, well, first you have to learn how to mobilize the community to make them appreciate and accept a new trend, a new initiative, something that is totally new for them. And the community is not mainly lay persons, but also research community, other stakeholders, including decision maker, policymaker, authority, and so on. It was tricky. So you start to search who could help, how could you start, how could you manage to initiate such thing. And one of the challenges was to raise awareness, to identify this as one of the needs for improving the current understanding of aging, and then later on improving the condition of aging population. So I started activities to raise awareness. And one thing I learned is, at least if we are talking about our region, it is very important to show them that we have another models internationally. So when you show that there are several aging studies in Europe, in the States, in Ireland, and other countries, this is a good asset. Maybe the international partners or the international models that you need to recapitulate or duplicate in your country, they are not, their strength or importance is not mainly to fund or give money, rather than to convince authorities, decision makers, and even the community, the other stakeholders, that this is something happening in other countries, other places, and it could be done in our, why not? So I started inviting SHARE. SHARE is an aging study for European Union, centered in Germany. I invited the president of SHARE, Professor Axel Borch-Zupan, and I was lucky enough to organize a meeting in the Academy of Scientific Research, and it was attended by high-profile authorities, including assistants to Minister of Higher Education, some of the higher consortium in the academy, and we started the dialogue. More important that I also was able to invite other stakeholders, researchers, community members, advocacy group for aging populations, those who are working in aging homes and houses and geriatric medicine and more. And this was, I would say, the kickoff of our activities, the kickoff of the initiative, that we raise the awareness that we might have something happening, that we need to have something happening. We need to change the current situation. Shortly after, I and Axel traveled to Lebanon, and also we presented our idea to start looking for aging population conditions in the Middle East. And also colleagues in Lebanon and Beirut were appreciating and welcoming. And in Lebanon also we met other colleagues from Jordan, and they showed an appetite to start collaboration. Okay, anyway, later on, after 2 months, we built on the previous initial meeting and we conducted another one, but this time it was somehow bigger. It was in collaboration between the American University and Global Brain Health Institute. We invited different stakeholders, international and national. We invited also several ministers and ex-ministers and presidents of university, researchers covering all Egypt. And I guess it was more success because we invited leaders like Victor Valcour and Brian Lawler from the Global Brain Health Institute, Axel Zuban, Kenneth Lange, and more. And they showed several models in different places. Even colleagues from South Africa showed that it could happen. It could happen even in countries similar to our situation, I mean, developing countries like South Africa or African countries. Shortly after, you can appreciate or find that several stakeholders start to be convinced, start to be enthusiastic, willing to support. Yeah, maybe the trick here is show us some money. How could you start such thing? We believe now it is interesting, it is important, but could you also convince international partners and stakeholders? With that in mind, we applied the American University in Cairo and the SHARE, which is the European Union Aging Studies, for funding from the DRD, and successfully we obtained the funding. I consider the importance of funding far beyond giving money or supporting financially. The importance of funding is endorsement of the idea, telling us that your idea is credible and can be done and of importance. And nothing could be more real or truthful, because actually after the funding, many of what seemed to be closed doors are starting to open now. People are appreciating, are engaging, are embracing our ideas. The aging survey is starting by capacity building now in Egypt, in Lebanon, and in Jordan. We are trying to harmonize the three initiatives in the three East Mediterranean Arabic countries. We have some hopes that we can recruit more funding, both internationally and nationally. We have some hope to recruit several partners, and this is happening actually. Now the American University is collaborating with Jordanian University of Science and Technology, with the American University in Beirut. And inside Egypt, we are collaborating with several national universities, several psychiatrists and geriatric centers. We hope that our longitudinal study in the three countries, the harmonized studies in the three countries, gain more potentials. We are now building capacities with the hope that by the end of 2021, we will be able to start a prototype or a pilot for the studies in the three countries, to be able to organize or harmonize the three cohorts, somehow in a fashion similar to SHARE in the European Union, but to a smaller scale. Recently, I start to receive even positive feedback from other Arabic countries, other countries in the Middle East, and even other African countries willing to get engaged more, to join our consortia. Currently, we are focusing on the success of our triad, but certainly there will be room for expansion of our aging study in the three countries and this experience. Hopefully, we will succeed. By the way, our aging initiative in the three countries is called EMAGE, which is Aging in the East Mediterranean World. Thank you so much.